Welcome to our webinar on Zika and the nervous system, emerging lessons for emerging viruses. Especially warm welcome to all our Zika Plan friends and colleagues. Also our friends from Zika Alliance and Zika Action. Special welcome to scientists and professionals from all around the world interested in the complex issues of Zika. Zika Plan is a research consortium funded by the European Union's Horizon 2020 Research and Innovation Programme to address knowledge gaps for Zika. One huge and a really central piece of our consortium and our almost 5-year project was dedicated to the neurological complications of Zika. And we focus on basic science, clinical research, capacity building and training and networks. A really exciting session is ahead of us. And without further ado, may I hand over to Professor Tom Solomon, who will be chairing this webinar. Over to you, Tom, and thank you.
Thank you very much, Anneliese. I'd like to add my welcome to everyone who is joining this seminar on Zika. So I'm Professor Tom Solomon. I'm based here at the University of Liverpool in the UK, and I lead the NeuroZika work packages along with my friends and colleagues Hugh Willison and Bart Jacobs. And we have a great collection of people who are going to be talking today. And I'm just going to ask everyone to turn their cameras on and give a wave so that you can see the fantastic lineup of speakers and participants. Come on, guys, turn them on, give a wave. Excellent and fantastic. So they'll be joining us throughout the afternoon. We have a series of people who are chairing each session, and we've allowed plenty of time for questions and discussion. If you want to move on to the next slide, that's some of the housekeeping, I think. The webinar is being recorded. Your videos and microphones have been disabled as attendees, but we do want to hear from you. And in fact, what I'd like all the attendees to do now is in the chat function, just say hello, tell us where you are listening from, and maybe about your interest in this program, whether you've been involved in the program or whether you're just interested in Zika and emerging viruses. And that will also tell us whether the chat function is working. So post your messages now. If all the attendees would like to just say hi into the chat function, then we know it's working. And as so you can post messages as we're having our talks, and make comments there. Also, you can use the Q&A function, which you'll see down at the bottom of your Zoom screens. I'm sure everybody's familiar with this now, and we'll address those questions after each of the talks. So I don't think there's masses more I meant to say. If there is anything, if someone from the Global Health Network wants to remind me if I've forgotten anything, and I would like to thank the Global Health Network team for providing the support for this meeting today. But if I've done all the things I'm meant to have done, then we will move on. And I'll hand over to Dr. Fatima Militao from Fiocruz, Brazil, and she's going to chair this first session. Fatima, over to you. Okay. Well, before we hand over, guys, I'm not seeing anything in the chat function, which makes me worry it's not working. So maybe some of the panelists could type in it, and maybe Bonnie and the team could just check it's working. And we'd like a setup where everyone can see the chat. So if you can make that setup so anyone can see the chat, that helps the dialogue. There we are, Hugh Willison's there, excellent. So what about, we know we've got at least 74 participants. Does anyone want to just post into the chat and tell us where they're from? It's what we normally do for these things. I don't think we're asking too much. There's Taran Dua Nickling. Okay, good, it's working, great. Well, let me hand over now to Fatima and Maria Lucia Brito. Fatima, over to you.
Okay. Hello, I'm Fatima. I'm an epidemiologist at Oswaldo Cruz Foundation in Pernambuco. Good afternoon, good morning for everybody. It's a pleasure to participate of this webinar and see how much you have learned since the beginning of 2015, when neurologists in the northeast of Brazil noticed an increasing numbers of cases of acute neurological disease, looking for care at emergency rooms. Many of these patients related an asymptomatic disease before the neurological manifestation, and their PCR test done at virological laboratory in Oswaldo Cruz Foundation, Pernambuco, showed Zika virus infection. Dr. Lúcia Brito, Chief of Neurological Service of Restauração Hospital, attended most of these patients and is going to speak about her experience at that time attending these patients. Lúcia, please. Lúcia will have 10 minutes to talk, and after her talking, we are going to have 10 minutes to discuss and to receive your questions.
Okay. May I make a little sharing? Sure. Yeah. Okay. Thank you, Fatima, and also the team from Zika Plan. And I would like to thank the possibility to share with this audience the work that we start during the outbreak of arbovirus since the end of 2014. And this is my conflict of interest. And we start emphasizing that before Zika outbreak, we prepare the Department of Neurology at Hospital da Restauração, elaborating the database and enhancing the medical record, at least in some areas, such as neuroimmunology, infection, epilepsy, stroke, and so on, and with some main focus, such as assistance, presentation in web meeting and congress, directed to the neurological communities, and also publication. At the end of December 2014, in the first months of the year, January 2015, we identified that we are facing an outbreak that should be arbovirus. And then we, after some discussion with our team, we decided that it's not dengue, but maybe some other arbovirus, because we identify the increasing number of neurological diseases linked to viral infections, such as GBS, ADEM, encephalitis, and others, and with the previous history of infection, and then to decide that should be neurozika. Just to focus on this graphic to show you when we faced the outbreak of dengue during 2001 and 2, we realized that an increased numbers of GBS, and also in 2006 and 7. But when we started to see these cases during the period of 2015 and 16, we realized that there is an increasing number of, for example, GBS cases, and call attention to the what are happening during that time. And the first publication that we organized to call attention to the neurological communities was this publication with the group of Rio de Janeiro, calling attention to Guillain-Barré syndrome and associated with Zika virus outbreak that are happening in Recife and also in some cases in Rio de Janeiro. This timeline show how we work inside the hospital and also with the Fiocruz team, trying to organize our cases and laboratory to identify what are happening during this time with these new cases with neurological disorders. And and at the end of 2015, the Minister of Health identified the hospitals in Recife and also in a city nearby Recife as a sentinel hospital to identify all the neurological cases that appear in the emergency room that was referred to these places, and also the labs that should work up our samples. And after that, we have some meeting with health professional from this municipalities, states, and so on. And also with the team of Fiocruz, we organized the research and submit to FACEP to support our work. And step by step, we did some adequacy in our database to include the patients. And also we discuss with the team of University of Glasgow and also in Ribeirão Preto, São Paulo, because we know that they are identifying some cases there. And we enhanced the clinical and neurological protocol adequacy of our data bank and start to include the patients. And then this team decide to be called as NeuroZika, and we submit our research to ethics committee of Fiocruz, and after approval we start to all the cases that we are facing during this time, and then we also take part in this wonderful meetings that occur in some places to discuss the problems of Zika and also other arbovirus related to neurological disorders. And as a result of this, we did our first publication that was in a tropical medicine and hygiene with our 6 first cases of Zika virus infection that you face in different ages and with this sort of signs, clinical signs and symptoms, and the interval between disease, clinical symptoms, signs, and neurological complications. And all these cases were positives, PCR positives, and 2 of them with virus isolation. And also step by step, as we call in this publication, we did other publications related to Guillain-Barré syndrome as a very huge team, and also a systematic review and meta-analysis about Guillain-Barré related to Zika virus. And also our case series, prospective case series with immunological disorders related to Zika and chikungunya. Is a very great number of patients included in this work with the central nervous system compromise and also peripheral, mixed, isolated cranial nerves and other disorders. And now we are preparing the group of the other disorders. We include stroke, and we are preparing our small number of patients that present with symptoms of stroke after infection. And we have 5 cases of monoinfection, 7 double infection, and 2 dual infection, Zika and Chik. And this is the publication that we are now waiting for. These two papers were accepted to be published in the next maybe 1 or 2 months. This is the differential frequencies of HLA, DRB1 and DQA1 and DQB1 alleles and haplotypes that were observed in arbovirus-related neurological syndromes that you study with a group of Agil Magalhães and Fiocruz. And the other one is a cytokine soluble HLA-G levels in acute and recovery phases of arbovirus infected in our group of patients with neurological complication. And there's a very important papers that we are now waiting for the publication. And I would like to emphasize what we learned with the Zika outbreak that should be useful for SARS-CoV infection. And maybe we have to include this to resist the fallacious feeling that the problem is resolved. We know that it's not resolved yet, while it's only in its seasonal behavior. To act in clinical practice, we have to emphasize that our team and other neurologists around Brazil, that we act clinical practice with an epidemiological perspective, to assume the role of knowledge multiplying public, private services, and for distance location, trying to discuss cases, present how to do the diagnosis and how to assist these patients, and to understand that the challenge in opportunity to start a point for developing a line of research. I think this is a message that you learn from Zika and you are practicing with SARS-CoV nowadays. And I'd like to express my gratitude for this huge and important group, and that we start studying these cases, and initially as NeuroZika and in a sequence with as a team of Zika Plan, and express my gratitude to be chosen as a speaker in this opportunity. And I think I am able to ask some questions that you propose for me. Thank you so much.
Hello.
Thank you.
So, thank you, Lucia. Very good. We have a question from Dr. Lida. During the outbreak of GBS and Zika, did you notice increasing severity or differences in clinical presentation with GBS associated with other potential etiologies? Lida Osorio.
Yes, I think we analyze these cases one by one, trying to emphasize the behavior of the GBS in these cases, but was not so different from the other cases that you face in another time. And maybe we are preparing the children cases, and maybe we have some cases severely affected differently from the group of adults.
Okay, I can add some information. We done a systematic revision with meta-analysis with Sonia, and we found that the GBS cases associated with Zika virus infections needed more ICU assistance, and the duration of hospitalization was were greater. Sonia, you can comment about this.
Yeah, yes, I can comment about that as well. Yes, you're right. So the GBS patients that had a recent Zika virus infection had high rates of ICU admission, higher than you would expect based on literature on GBS patients that had a different kind of infection. So this suggests that maybe Zika virus related GBS is a more severe type of GBS, which I think is what you were aiming at, huh?
May I add some comment?
Yes, I was wondering,
Okay.
because
I think the cases that we identify as having a dual or co-infection, we realize that they are more severe than the others. But if we compare the other cases, it's not so strong as we saw in our everyday life. But when we compare with the children, I think we have more things to add.
Julia,
Really?
Edgar has a comment, I think. Julia, go ahead.
Lucia, thank you for your nice presentation. You mentioned a publication that's about to appear by Almeida et al., where you talk about disease and resolution and cytokine production. How do the levels of cytokines correlate to disease versus resolution?
Yes, we identify that there is some decreased level of anti-inflammatory cytokines in the acute phases of this the serum of these patients when we compare with the control group. And differently, we have more inflammatory cytokines in this group than in the other group, and also less anti-inflammatory cytokines.
Okay. We have also a question from Dr. Hugh Wilson. Hello, Lucia. What are the commonest infections apart from Zika that trigger GBS in your receive community now? I understood. Nowadays.
Nowadays, we have some cases of SARS-CoV and GBS presentation after 2 or 3 weeks of the infection. And I think so. We have no cases registered with the variant of the first identification of SARS-CoV. But we have now some cases presented with SARS-CoV and GBS.
Okay.
If we look around the world, Lucia, it's Hugh Willison here. There are many different infections which cause GBS, and of course, there's been this great interest in COVID-19 and GBS. Are you saying that you've seen a few cases, or and do you think this is at the same kind of frequency that you saw with Zika, or do you think it is less common a complication of COVID-19?
It's an amazing thing because when we are in a Zika outbreak, we realize that there are a very amount of cases related to Zika and GBS. But nowadays we are comparing the cases. It's not so strong as we saw during Zika outbreak. It's less than this. I think there is no, maybe during the year, we realized that related to SARS-CoV, we don't see more than 5 cases.
Yes, that's an interesting remark, Lucia. We've, Professor Lan in London, and Tom's been involved in this surveillance as well, have not seen a large number of cases of GBS with COVID-19. And maybe Sonia can comment on the experience from IGOS COVID-19 register, where again, it doesn't seem to be anything like the frequency that we saw with Zika.
Well,
So I think your experience is rather similar.
That's a nice lead into the next session, which is going to be on GBS, and Sonia will be talking then. But just before we move to that, there is one question come from Dr. Vasconcelos, who asks, it's known until this moment that Zika infection may bring some problems to the urinary tract in children. Did your group find neurogenic bladder problems in patients with Zika or chikungunya too? That's from Dr. Vasconcelos in the Hospital de Restauration. Lucia, if you want to answer that, thanks.
I can't hear well this question, please, Tom.
So the question is about urinary tract problems in children, and Zika causes neurogenic bladder in children, but did you find this in adults? Did they have bladder problems through Zika or chikungunya infection?
No, nowadays we have, we are preparing the cases that we have from the pediatric ward, and we have no data now that we consider as an important point that we have to take and to show in this moment. And but maybe the cases from the pediatric ward is the behavior of the children is different from the adult, and maybe we have some differences also if we study these cases genetically and with immunological aspects or neuroimmunological aspects. Maybe if we have support, maybe we do this sort of evaluation in this, trying to compare both groups.
Great. Well, thank you, Lucia. Thank you, Fatima.